This video makes me thirsty. Hi, I'm Mandy. What if you could feel better during your pregnancy and prevent complications that make you wonder, should I go to the hospital? Am I in labor? Do I need to call my doctor or consult Dr. Google? Let me help you with one simple solution for all of those things. If you're new to my channel, welcome. Thank you so much for watching. I share my unique experiences and my knowledge as a labor nurse because I believe that women's bodies are extraordinarily powerful, and with the right support, we are unstoppable. If you agree, or you just like watching videos that answer questions about birth, please consider subscribing. You don't want to miss anything. We're talking water today if you haven't read the title. And I'm gonna help you use it to prevent problems in pregnancy. But how do you know how much is enough? And what do you do if you don't like drinking water? Stick around, I'm gonna answer those questions too. Okay, let's dive in. Preterm labor and 7 other complications that can possibly be prevented with just water. Preterm labor. The uterus is so cool. It's this huge organ that grows and grows and grows with a baby inside, all during pregnancy, and then at the end, it has contractions. So the muscles around it, or the uterine muscle, tightens, causing contractions and helping the baby be born. Before the end of pregnancy, we want the uterus to be quiet and not contract and not tighten. If it's dehydrated, however, it becomes irritable. When I become irritable, I'm grumpy, I'm tense, I lash out at people pretty quickly, I'm not fun to be around. Same as a uterus. It gets crampy and starts hurting and contracting, even though it's not really time. With time, it can pull up that cervix and dilate the cervix, causing preterm labor. We do not want that. So we have to keep the uterus happy with water. Number 2, the common cold. Water can help boost our immune system. And the crazy part about pregnancy is mama is supporting 2 immune systems. So we want that communication in the placenta between mom and baby to be efficient. So we stay hydrated. So if she stays hydrated, that communication is efficient and can help prevent mom and baby from getting sick. Number 3. Nausea and vomiting. Dehydration can cause nausea and vomiting if it's severe, but there are a lot of reasons why pregnant women become nauseous and vomit. And not all of them are preventable, but if the vomiting causes dehydration, then it's this vicious cycle of nausea, vomiting, dehydration. And because she's dehydrated, it's really hard to catch up and prevent that nausea and prevent that vomiting and get out of dehydration. So being very aware of your hydration, very aware of your water will help prevent that vicious cycle. Nauseous, throwing up, and she's dehydrated, and that makes her nauseous and vomiting, and then she's nauseous, throwing up, and that makes her throw up, and that makes her more dehydrated. Not good. Not good. Number 4, decreased fetal movement. If your baby isn't moving as much, that can be a sign that she's not getting enough oxygen and nutrients, which pass through the placenta. So in order to increase those nutrients and that oxygen, we need to keep mom hydrated, to keep that communication going in the placenta between mom and baby. Number 5, low amniotic fluid. The amniotic fluid is that water that surrounds the baby, and low fluid can be indicative of a baby in distress. So we want to keep that fluid up, and there are studies that show that mom's hydration can increase amniotic fluid levels. Yay! Well, that's easy. Number 6, bladder infections. These are painful complications of pregnancy, and preggo women are at risk. So staying hydrated keeps that urine flowing through the kidneys, through the bladder, and out to decrease her risk for a urinary tract infection. Number 7, constipation. Oh, constipation. There are so many reasons why pregnant women can get constipated. Our prenatal vitamins have iron in them and they can cause constipation. Anti-nausea meds can cause constipation. Everything's shifted up when you're pregnant, which really messes up your gut. And an unhappy gut does not work properly. So you get backed up. So increasing water intake can help prevent and treat constipation. And finally, number 8, dizziness and lightheadedness. A lot of things can cause dizziness and lightheadedness in pregnancy. It's not just dehydration, but water can help if it is dehydration or low blood pressure. Pregnancy is supposed to be magical, but your body goes through so many changes. It's hard to know what's normal pregnancy and what's a real problem. Staying hydrated, drinking enough water can help your body stay healthy and ready for all of the changes of pregnancy so that it's easier for you to tell, is this a problem? Do I need to call my doctor? Or is this just normal part of pregnancy? Sometimes you can be in triage for 8 hours while your provider is trying to figure out with you, are you having a pregnancy complication or is this a normal side effect of pregnancy? Or are you really freaking dehydrated, which is really common. When I'm the triage nurse, everyone in the bay gets a big jug of water. Of course, this is not going to stop real labor, but a lot of times water can help solve a lot of these problems and just help make you feel better. So save time, save money, save your health and stay out of the hospital if you don't need to be there. There's sick people in the hospital. Just by staying hydrated and preventing some of these common pregnancy complications that water can fix. Okay, what is enough? How much water do I need when I'm pregnant? Well, it's recommended that you have about 8 to 10 8-ounce glasses of water a day. A day. Each day. Every day. Yeah, that can be a lot. I recommend getting your favorite water bottle, looking on the bottom to figure out how many ounces or milliliters it can hold, and then doing a little math on your phone to figure out how many of those you're going to need throughout the day. Insider tip. Oh, you don't like water? That's okay. Try adding berries, your favorite citrus like lime, lemon, orange, grapefruit, herbs. I've heard of people putting basil, mint, cilantro in their water. There's a lot of different combinations you can try. And just let it sit in your water. It makes it taste really good and it's good for you. It has antioxidants in it. Ice cold water can be easier to drink for pregnant women, and drinking it through a straw or trying sparkling water. If you can't keep just plain water down, that can help. All of these tips and even a few extras are in a blog post on my website, and I'll put the link down below so it's easy to find. If this was helpful, thanks for the thumbs up. Share it with a mama that you know. There's a fly in here. I don't